it's Dr. Mamina Turegano, and I'm a board-certified dermatologist at Sonova Dermatology in the New Orleans area. And today I'm going to talk about how to treat texture and pigment and what services are offered at Sonova Dermatology. First, I just want to briefly touch on causes of hyperpigmentation. It's super common. You're not alone if this is something that you deal with. It can be caused by a variety of things, such as like hormonal imbalances, which is a huge cause of something called melasma, where you get these brown patches on different parts of your face, like your cheeks or your forehead or above your lip. We see this in the setting of pregnancy. We see this in the setting of taking birth control pills. Of course, the sun plays an enormous role with pigment production. The suns activate our melanocytes. These are the pigment producing cells to produce more pigment. So that's why we always talk about sunscreen, because that is probably one of the biggest players. Genetics certainly plays a role, and there are certain skin types that are more prone to developing hyperpigmentation. So people who can tan more easily are more likely to develop hyperpigmentation issues. And then, of course, if you have any kind of inflammation in the skin, whether it's acne or really intense rashes, that can result in post-inflammatory hyperpigmentation. Skin injuries can leave some hyperpigmented scars. Aging skin, that's related to just sunspots and whatnot from excessive sun exposure. And of course, there are some medications that can make you more sensitive to the sun, or medications that can bring on hyperpigmentation. And there are a variety of ways that we can treat hyperpigmentation. We use a couple different lasers in our office, and we also use microneedling as well as chemical peels. And I do think skincare is super important. If you're going to do procedures, I definitely recommend using skincare along with procedures. If you do procedures and don't go back to skincare, your pigmentation can come right back. All right, so first we're going to talk about lasers that specifically focus on pigment. These include things like IPL, or intense pulse light lasers, XLV, and laser genesis, which laser genesis is kind of part of XLV. And these are lasers that use specific wavelengths to treat blood vessels, brown spots, redness related to rosacea, as well as skin texture. We can treat a variety of areas. Most commonly, we do treat the face, neck, chest, and hands. We do recommend multiple treatments, 3 to 5 with 4-week intervals. Downtime is not too bad. You can get more redness for the first day or two, and sometimes bruising, but that depends on like what setting is being used. But with brown spots, sometimes the brown spots are a little bit darker, but those will eventually fade with good sun protection. And I'm just going to show some examples of patients who were treated with these lasers, specifically the IPL laser. As you can see, a very much notable improvement in the hyperpigmentation, as well as some of the fine lines too. In this gentleman, you could see that there was more hyperpigmentation and kind of modeling of this discoloration on his cheeks, much smoother and clearer in the follow-up. And same with this patient, you could see just many more spots in the before picture. All right, next is laser resurfacing. So this is a more intense laser that can address multiple issues in addition to hyperpigmentation. And the one that we most commonly use at Sonova is the Fraxel laser. So this uses wavelengths that also go deeper in the skin. It can heat up the collagen to tighten the skin. So this is great for those who also want to address fine lines and wrinkles, but it also resurfaces the skin to help with hyperpigmentation and evening out skin tone. And I like this because it really can treat multiple issues with one laser. In terms of treatment areas, we can work with a lot of different areas, but most commonly we treat the face, neck, chest, arms, hands, and around the eyes. You can do 1 to 3 treatments per year, but I do have to say even doing one treatment can make a dramatic difference. Now with the Fraxel Dual, which is what we have in our office in New Orleans, the downtime's about a week. With the Fraxel Restore, it's a little bit more gentle, so it is shorter than that. Okay, so let's look at some examples with the Fraxel. This is with the Restore one. And as you can see here, there's a dramatic improvement with the hyperpigmentation and unevenness before and after. Okay, with the chest, we love to use Fraxel laser on the chest just because you can get really great improvement, as you can see here in the before and after photos. The chest I do find can be a little bit more stubborn than other body parts like the face, so you may require a few more treatments, but this is definitely a popular area to get treated with Fraxel. All right, next there's microneedling. Microneedling is basically a device that uses these tiny little needles that you can barely feel, especially with numbing cream, but they're tiny little needles that cause these, what we call almost micro injuries into the skin. And when you create these injuries, it induces like collagen remodeling, collagen production. And the other cool thing is that when you are creating these injuries, you're creating like these microchannels. So it's a great opportunity to apply serums or skincare products that can really target your skin concerns. So if you're dealing with hyperpigmentation, there are some awesome skincare products that we can use along with microneedling. Microneedling can also help with other things. We use it a lot for acne scars, treating fine lines, helping with pores. It can help with stretch marks. And then, of course, we talked about hyperpigmentation. The procedure isn't too bad. It's a 15 to 30 minute procedure. And I do find that the downtime's not that bad. We'll talk about it here on this slide. So we typically recommend about 3 treatments spaced 4 to 6 weeks apart. For those who deal with, really deep wrinkles or really bad acne scars, you may need more treatments, like 5 or more. And, we kind of treat the areas of concern, but we typically at least do the full face if you have any issues on the face. And like I said, the downtime's not bad. I mean, I even think after 24 hours, you can look normal. It's usually the first 24 to 48 hours where you can look pretty red. All right, time for more examples. So as you can see here, there's a wonderful improvement in the before and afters, just with the unevenness and hyperpigmentation. You can just see that the skin also just looks smoother. Once again, really great improvement in the after photo. And as you can see here, I mean, even freckles can be treated, and you could definitely see a great improvement in the after photo. And this one is microneedling with PRP. So I didn't really talk about PRP in the original microneedling slide, but PRP, which stands for platelet-rich plasma, is something that we often like to use in conjunction with microneedling. PRP is the serum that we get when we draw your blood and we spin it down in a centrifuge. We extract this serum called platelet-rich plasma, which is full of growth factors that can help stimulate collagen and renew your skin cells. And as you can see in this example, there's a very good difference between the two photos here. And as you can see here, I mean, this is pretty dramatic as well. And we like to use microneedling with PRP because PRP, the growth factors are actually fairly large. It's hard for them to penetrate the skin normally if you just apply it to the skin, but with microneedling, with opening the channels in the skin, the PRP can just work so much better. And just another angle of that patient. Look at just the difference, not only with the sunspot, but also just the background hyperpigmentation. And also another example here with some hyperpigmentation. It's kind of ill-defined hyperpigmentation, but definitely improved. And what I think is really cool about this example is that you can actually also use it for like dark circles. And we can see here just the improvement with the hyperpigmentation. And that's with PRP also being injected in that area. All right, let's talk about chemical peels. I'm definitely a big fan of chemical peels for hyperpigmentation, especially melasma. I also think it's like a good, almost like gateway procedure because, it's not too involved in the office. There is a little bit of downtime where you could be peeling. Usually the peeling can happen days 3 through 7. And yeah, depending on what your skin concerns are, there are different ingredients that are used in chemical peels. And I would say, for hyperpigmentation, we do use a lot of alpha hydroxy acids, and we also use things like hydroquinone, as well as TCA, trichloroacetic acid. So yeah, I think this is a great option, especially for melasma. Okay, and last but definitely not least is skincare. I actually find skincare to probably be the most important component when treating hyperpigmentation. I do think it's like the foundation that needs to be set before doing all these other things. And I think that your procedures, you'll get so much more out of your procedures if you do have a good skincare regimen. And I would say out of all the components in the skincare regimen when treating hyperpigmentation, I would say sunscreen is probably the most important component. And when people ask, oh, what's the best sunscreen to use? I usually tell people the one that you're willing to use every day, because we have seen that consistent daily use has provided the best results. But when it comes to hyperpigmentation, I do prefer tinted sunscreen. So sunscreens that have like a little bit of a tan or brown tint to it, almost like a foundation. Because these sunscreens, the tint is from an ingredient called iron oxide. And iron oxide has been found to block something called visible light. So of course there's UV light that can damage the skin, but visible light can also accentuate hyperpigmentation. And visible light is something that we encounter indoors. So you can't escape. You gotta wear sunscreen both outdoors and indoors. Of course, if you don't want to wear tinted sunscreen, even a regular sunscreen is good. I do think that if you're going to stick with a non-tinted sunscreen, try to look for one with mineral ingredients like zinc oxide or titanium dioxide. Okay, so in addition to sunscreen, what else is there? I do think using a retinoid is important. So there's prescription retinoids and over-the-counter retinoids. The most common prescription retinoid is tretinoin, which is the generic retinoid for Retin-A, and a lot of people have probably heard of that. There's also over-the-counter retinoids, so things like retinols. And what retinoids do is increase your skin cell turnover, so you're getting rid of that old pigmented skin and getting that fresh, new, clear skin. All right, after retinoids, I also do think vitamin C antioxidant serum is very important, and this is something that you would use in the morning before your sunscreen, because vitamin C also helps protect your skin from UV damage. I also think it's important to incorporate regular exfoliation into your routine. Exfoliating agents include things like alpha hydroxy acids or beta hydroxy acids. Alpha hydroxy acids, the most common one is glycolic acid, but I'm also a fan of lactic acid. And then there's things like salicylic acid, which is a type of beta hydroxy acid. I don't recommend using exfoliation every day. I think you can use it 1 to 3 times per week, depending on the strength of the exfoliating agent and your skin type. And I do recommend alternating it with your retinoid, because both of those can be potentially irritating to the skin. And if you use too much, it's going to potentially damage your skin barrier. Now, when it comes to skin lightening ingredients, there's a bunch out there. I would say hydroquinone is the most commonly prescribed anti-hyperpigmentation ingredient out there. It works really well. It's not something that we do recommend long-term use of, but it is something that can definitely work to really quiet down the hyperpigmentation. Now, there are some other ingredients that you can use alongside hydroquinone or in place of hydroquinone, and these include things like tranexamic acid, kojic acid, alpha-arbutin, hexylresorcinol, niacinamide, azelaic acid, soy, licorice root. I mean, there's a lot out there. So there are options. But yes, I do think that skincare is very important. Also, everyone's different. So I do think it's important to talk to your dermatologist to really get a customized regimen that meets your needs, your goals, your skin sensitivities. I know that's something that I love to do and love to help my patients with. But yes, anyone at Sonova can definitely help you with that. All right, well, that ends the presentation. Hopefully you learned something about how to approach hyperpigmentation and to see what all available options there are out there. And I hope that you can also take away just the importance of skincare when dealing with hyperpigmentation. All right, thanks for listening.